I had someone come in the other day with Trochanteric Bursitis. Now this is when you develop pain that is on the outside of your thigh, so just in here, and it can be quite tender, and when you point on it, that's where it's sore. And if we look at the inside of your body, here's your pelvis, goes down to your hip joint and up round joints into your spine. This is just half of your pelvis, and then you have your thigh bone or femur is here, and on the top of it is a lump called the greater trochanter, and this bursa sits just here. And part of the problem is that there is a band of tissue called your iliotibial band, which runs down past it from your pelvis into your lower leg, and for various reasons this may cause repetitive trauma to that bursa. So the things that can cause trouble are if you fall on it, so landing on it, if you have walking around on a hill on the side, so if your leg length is uneven, sometimes that will cause trouble. So repetitive trauma is quite common. Repetitive. And other people find that sleeping on it's a problem. I had someone who came in and they had been walking around the hill at the zoo with their child on their hip for half a day, and that had caused trouble. So the things that we can do to settle this down is stop the repetitive trauma is the main thing. So if you're running and jogging and things, you maybe need to stop that for a little while. The other thing that you can do is do some stretches that will help. So one of the stretches is to lean against the wall, and so that you've got one leg, the good leg is again near the wall, and then your bad leg you put behind you or to the other side, and you lean towards the wall. And what this does is stretches that iliotibial band, which is this piece down here, and lengthens it out so that it's a bit more flexible and it stops putting pressure onto the bursa. The other thing that we sometimes do is a steroid injection. So steroid injections go into the area and they take a few days to work, but sometimes they can last for a few months as far as their benefit, and that injection just goes straight into the area around the bursa.